get 5 million patients in outpatient department in a year, almost to the tune of 15,000 outpatient patients, and having an emergency of 800 or so, and doing a surgery of 1,000 patients and admissions of 1,000 in a day. Such a big, huge number. The crowds doesn't lead to confusion, and there is no chaos, and we're managing it. It's through our services, our IT technologies, and our various solutions of good governance which we have put in. So this is a glimpse of how a one day in the All India Institute of Medical Sciences looks like. Just wanted to share with you. And where do we stand it? People say that when the large numbers are there, the quality cuts the quantity cuts the quality, and all those things. It's not just a hospital which we are looking at. We are also looking at how do we give our best of the hospitality in addition to the hospital. That's where today, when the rankings are happening, the national and international, where do we stand? Recently we were awarded the 6th in the Brand Finance Global 250 hospitals. And this is the first time that an Indian hospital, from the government as well as the private, has come into the global rankings. So this is something which I wanted to share with our international dignitaries. And then, where do we stand with the international Newsweek internationals and various rankings which are happening? For the first time in the history of the country, the institution has come within the 100 of the government and the private institutions in the country. And we're the number 1 in the country, and we are 97th in the global rankings when you look into the best hospitals of the country. And then, of course, in our own institution, in our own rankings of the National Institutional Ranking Framework, we are number 1 as a medical university, we are number 1 as a medical hospital, and of course we carry forward the Trinity mission of the patient care, teaching, and the research as well. And then, are we not doing the research? Yes, definitely we are doing research, and we are number 1 with respect to the research rankings with respect to the things. The people always say that hospital is supposed to just take care of the patients or so. It's not just beyond. We go beyond that. Look into the national programs which have happened. Each one of them has happened through the policy, advocacy, thinking, handholding to the Niti Aayog, the ministry, and the various protocols, SOPs, guidelines, and all. And today, whatever the programs which we have in the national level, they are the part and parcel of the policy advocacy, the knowledge inputs given to the government, and also to the various programs, the clinical trials and the national programs which we are going through. I'll not go into the details, but just to say that, today we are having iodization of the salt because the research started at the All India Institute of Medical Sciences to say that the iodization is necessary to prevent the goiters in the country. Where do the patients come from? It's not just within the country, but even the neighboring countries also we get the patients. Large number of patients come for the complex and complicated diseases. They say that, sab kuch ho gaya, sab kuch big gaya, sab kuch nahi hai. And that's a last hope for all these patients who come from rest of the country and even the neighboring countries and say that, this is an oasis of hope for us. And that's where we stand today to say that the foundation pillars, the basic foundation of the Trinity mission of the institution is patient care, teaching, learning, and research. And of course, we're adding up one more foundation there as a good governance for us. When you look at a large number of 5 million of the patients, then people think that, the crowds lead to the confusion. Today that we have deciphered that out, and there are IT solutions, there are governance and the transparency modules which are available to say that, the patient experiences seamlessly into the institution, right from the entry up to the discharge of the patient at the hospital. And that's what, there are various mechanisms, the initiatives with solutions which we have put into that is giving us that how the patients when they come, how do they taken care. And we are part and parcel of the various programs of the Ayushman Bharat Digital Mission. We got the prize for the highest number of the ABBA IDs which we have created. And then we are with respect to the Ayushman Bharat Digital Mission and also the PMJ program, treating the patients free of cost in this institution. Whether they are insured or not, the treatment is free in our institution. And then we are 24/7, not only just for emergencies, but also for the routine investigations and the radiological investigations and all. Main hospital is almost to the tune of 250 acres, and then if you look into our satellite centers, they come to almost 600 acres of campus. So we just wanted an intra-hospital navigation. Google also will not help us because when the patients are in the basement or in the elevators and the lifts, there may not be a possibility of the the GPS location, but we have our own intra-hospital navigation system which has been put there so that the patient at the click of the button will find out where to go, how to go, and there will be a Disha for that, and that's what the Disha app is called, which we have put it. And of course, we have various generic the medicines and Amrut pharmaceuticals outlets in our institution. The patients who come for the institution, they come with a lot of hope. They may not have the relatives. They cannot afford to stay in the hotels and the areas. So that's where we have created the Vishram Sadans for them so that they can have the patient attendants can stay in those Vishram Sadans in the institutions. Large number of waiting areas. Those I request the international delegates to visit the place and say that it is like an airport lounge. We have created the waiting areas for our patient attenders and the patients in the hospital. Staggered appointment systems, online appointment system through the ORS portal, and staggered appointment to the timings of the consultations. And of course, we are part and parcel of creating ABBA ID. ABBA ID is a unique health ID which is there under the Ayushman Bharat Digital Mission. And then we do have our teleconsultations to the patients for the follow-up. Whenever they wish to have a follow-up with our doctors, we can have a teleconsultation with them. When you visit a mother's block in the institution, you can see that there is a special launch for the mother's nest, which we have called it. That is something which gives a feeling that mothers, the patient attendants are also taken care in the hospital. That means just to say that it is not just a hospital, but we are taking care of the hospitality also. That's what I just wanted to give some through the pictures. We are part and parcel of bringing the artificial intelligence into the healthcare, and we are the medical partners for our the big mission of health in AI the government of India has embarked upon. And we are working with Indian Institute of Science, Bangalore, and IIT Delhi to give these AI solutions to the nation and to the global south. Because whatever the solutions which the All India Institute of Medical Sciences is getting are the solutions for the global south. And that's where we have put our money and energy and the time and the research and the R&D into the AI, into the healthcare. And recently we had a Honorable President of the French Republic to visit us, that AI in the healthcare for the French, which we want to take it, a joint collaboration between the Indian institution and the French institutions to give AI solutions in the healthcare so that we will make an early diagnosis, make a precise diagnosis, and to the treatment and the follow-up. So that kind of solutions are going through the collaborations which we have. And then there are people, we have our own center in the Antarctica. Recently, we showcased the technology where sitting in the All India Institute of Medical Sciences, New Delhi, we were able to do the ultrasound diagnostic test from the Antarctica. We can reach out even to the 12,000 kilometers of the area. Geographical boundaries have been siloed, have been broken, and then we are reaching out to the large number of areas also for this. All India Institute of Medical Sciences is the first of its kind where the robots are not just in the hospital to take care of the patients and they do the surgeries, but also we are at the wet lab and the dry lab where we are imparting the training to the young doctors and the trainees that they can have a robotic surgery training and the enhancement of the skills in our set facility. These are the pictures which I wanted to share with you, that how we are imparting the surgical training to the people who want to get trained. And we are the only hospital in the country where not only in the hospital but also in the skill lab, we have all the robotic surgery solutions for the training so that the people can enhance their skills. And of course, we have all the transplants right from the renal transplant, and then we're looking at how we can go into the phase transplant as also. Recently, we had a collaboration, MOU signed between the Indian Space Research Organizations. We want to go beyond the boundaries of the institution and beyond the boundaries of the earth to look into how best we can look into the research and development, bring back the solutions from the space research to the mankind for the treatment, for the early diagnosis, so that we can share with the rest of the world that how a research done from the All India Institute in the space can come back and help the mankind so that we can have a frugal innovation done, because India is always known for the frugal innovation, and we look into that how we can give affordable care to the patients and the masses, and that's where we are looking at how best we can look into the space research into the health also. And then this is the transformation in the healthcare. The All India Institute has done it. How the patient journey, how this is going on. We have our own dream of transforming and then going into the master plan, into the big health university on our own, because our institution from 1956 has the buildings which are a little older. So we are going with the bigger vision of bringing the newer buildings so that we truly become not only by the care, but also not by just the quantity, but also by the look and the feel of the patient experiences also. That's the vision which we carry. And ladies and gentlemen, I just wanted to share with you, it's not a small thing that we handle 5 million outpatient departments in a year. This is something which the patients come from nook and corners of the country. Complex diseases, complicated diseases, they all come together and then say that this is an oasis for all of us, the poorest of the poor in the country. He doesn't have to spend anything. He comes with a hope and says that, ye hamara All India Institute of Medical Sciences Delhi hai, and this is really an oasis of hope for the poorest of the people and the people who are not reached in the nooks and corners, not only from the country, but the neighboring countries they come. And then we, as a collective team, give them the best of the treatment. And there are rankings which I have shown you, and there are people who have ranked us that we are no less than the best of the centers of the world to give the quality care to our patients who come to us. With this, I once again thank you on behalf of the All India Institute of Medical Sciences. Thank you very much.
Thank you, Professor Srinivas, for your address. Director AIIMS, AIIMS continuing to create path-breaking innovations, discoveries, and of course save lives every day. Okay, now moving on to the future of health tech, staying with this theme, we move on to our panel discussion now, where we are going to be joined by the founder and CEO, Superhealth, Varun Dubey. Mr. Dubey, could I please have you on stage? We also have with us Arunoday Singh, Thinker O-Health, and Nitin Guru, RX1 Care, and this will be moderated by CEO, Basis.ai, Amber Nigam. Thank you all, gentlemen, for joining us. And Mr. Nigam, I hand the floor over to you to talk about the future of health tech. We are very intrigued to know what you have in store for us.